Hello, testing, testing. Okay. Good morning. Everything looks good. No technical glitches. Today is the Saturday, April 16th, 2021. Sorry, 2022. 2022. This is our regular Saturday morning yoga therapy class. As we explained, even in the last Sunday, when we had our whole day yoga therapy retreat, we discussed every item from our own personal experience of practicing yoga therapy for years and years with a large number of participants. So today's topic is yoga therapy, empowering the healer within you. This is our experience that yoga therapy, as you all know, is an adaptation of the practice and the philosophy of yoga based on the patient's or client's clinical condition. But what we found from our experience is that more of a health, that means the two components of yoga therapy is the roger chikitsa, treatment of the disease, and shastha, maintenance of health. Our observation is yoga therapy is more of maintenance of health, providing the health to create what we call in our Western medicine is the preventive medicine. In a preventive medicine setup, what you have the healer within you. We had a topic 2 weeks back, which was your self-care is the health care. As you can understand, what we mentioned, that a disease care you can buy. You can pay a doctor's fee, you can pay a hospital, you can buy medication, you can have a procedure done, which disease care you can buy. Health, on the other hand, you have to earn. You have to earn yourself, and nobody is going to provide health to you. And our experience says that only way you can earn your health by waking up, awakening the doctor within you, empowering the healer within you is the therapy or therapeutic component of yoga, and the preventive medicine, the maintenance of health, shastha. I have all my statements. I repeat the same statement all the time. For one single reason is for you, especially the long-term yoga practitioners and the yoga therapy teachers, to be embedded. I say call it itching. It has to be etched in your brain. Is that there is no better healer than the self. Self, me. Aham Brahma Ashmi. I am the divine. I am the healer. I am the creator of my software, which is my mind, and the software will take care of my physical body, which is my hardware. And always remember, it is not the I, it is the we. We always talk about the illness starts with I, wellness starts with we. Convert your thought process, convert your vocabulary from I to we, a illness becomes a wellness. And this was the topic of our theme topic for our yoga therapy retreat, which was from illness to wellness. As you know, we do our daily routine called Dinocharya. As you see, we always have a little bit of nasal drainage throughout the whole day because we do the Jalneti using a neti pot every single day. Very simple answer. You wash your face, wash your eyes, wash your hair. And these nostrils, which is carrying your life force, the prana, keeps you awake, alert, and alive. You are not keeping it clean. Through the whole night, it gets dirty. We also do the little oleation. We put a little oil before you go to bed, so the dirt doesn't stick to inside your nostril. So the best way to empowering or awakening the healer within you, as I said, the best healer is the self. Next statement, which you always heard from me, I'll be telling it until my last day, is that I am the cause and I am the cure. Whatever illness or disease I have, I am the creator of the disease. Disease are two kinds: exogenous disease and endogenous disease. Exogenous disease coming from outside, this COVID-19, flu, allergies. That is because our immunity is low. When immunity is low, all the external pollutant, external bacteria, external viruses gets us. Daily practice of yoga improves your immunity. No question asked. Increases your ojas. When the immunity is low, from endogenous, from inside, you develop cancer. Cancer in Ayurveda called a Manda Agni. Low Agni in Saptadhatu, 7 tissues. All the 7 tissues have a low Agni, low Tejas, which causes a cancer in our body. Immune system can also be hyperactive. Hyperactive immune system causes external source, will cause an allergy. What is allergy means? When the regular pollen is coming, Because my immune system is hyperactive, it is reacting to produce the chemicals which is creating a phenomena called allergy. And from within us inside, when our immune system is overactive, not in balance, it creates a condition called autoimmune disease. Immune system is going to attack anything coming from outside, and this one is attacking inside. When you start awakening the healer within you, it balances your immune system. Remember, body is like a bicycle. What you need the bicycle to be functioning. First, proper inflation of both the tires. That means your right side and left side of the brain has to be functioning equally, which is not. I'm a right-handed, right-footed, left-handed, left-footed. We are called lateralized. One side of the brain is more functioning than the other. Start balancing poses. Every single day you create balancing poses. Stand on your one foot, non-dominant foot. Stand with your eyes closed. Next, this bicycle, to keep in balance, what it needs, bicycle needs to be moving. If you keep a bicycle at one place, it will fall. So bicycle needs to be moving to keep it in balance. So what we create every single day is called sit, rise, test. Throughout the whole day, we practice. Whenever you get a chance, sit down in a squatting pose and we'll get up without a support. Sit down all the way to the ground and get up without a support. Money back guarantee, sign of your health within you, awakening the healer within you. So I am the cause and I am the cure. Then listen to the doctor within you. And so many times a person will come and tell me, my doctor says, do these things. I don't want to do this. I said, why don't you want to see a doctor? You went to see the doctor for a reason. You went to see the doctor for your preventive care, for your treatment care. For myself and my family, we go for a regular checkup. And the best part of checkup is my physician tells me, wow, look at you. Look at your numbers. Look at your health you're providing. Look at your book. You are going to teach us more than I'm going to take care of you. I just moved to a new area. I just have a new primary care physician. And that was his first statement. But to awaken the doctor within you, you need to do what is called quietening your mind. Manasthir. And also you have to keep your physical body in a posture called Sthiram Sukham Asanam. Sthiram is the stillness, Sukham is the happy, and Asana is a pose. Here I am, I'm in a easy pose, Sukhasana, I'm Sthiram, still. Sukham, I'm happy sitting in this pose. Just to create balance, as you all know, we do it all the time. I'll change my foot. I activate other side of the brain. One side feels a little easier than the other because we are lateralized. One side of the brain is more active than the other. Manasthir. Mind is the content of your five senses. I hear, I see, I smell, I taste, and I touch. The content of the five senses is your mind. You learn how to control your five senses and able to learn how to reject the five senses, which is the fifth limb of yoga, pratyahara. Pratya means reject, ahara means intake. Intake doesn't mean that the food intake means what you hear, what you see, what you smell, what you taste, what you touch. So control of your five senses quiets down your mind, and in a day-to-day activity, keeping your spine straight. The moment you keep your spine straight, you have a large number of muscles called paraspinal muscles. These muscles gets relaxed. Normally, to keep my skeleton to be straight up, these muscles are contracting. Always in a state of contraction. Put your two hands, you find a two piece of stone sitting here. But when you keep your spine straight, in a short time you develop this neuroplasticity, you develop the relaxation of the paraspinal muscles. Muscles are next to your spine. You become very calm. You get into the Sthiram Sukham Asana. First evidence is what is happening even me. I have a tremendous saliva in my mouth. My whole mouth is wet. I don't know when the last time I drank water, probably Ushapan in the morning. When I got up in the morning, I sat down, I drank 2 glasses of water. This is my last water I drank. But my mouth is completely full of water. That is a sign of parasympathetic activation, sign of a relaxation response, sign of you are doing your introspection, started looking inside you. When you exercise, as I said, exercise is sympathetic. Heart rate goes up, blood pressure goes up, respiratory rate goes high up. Then the body starts having a homeostasis, have a parasympathetic activation. Heart rate comes down, respiratory rate comes down. You are in a state of calm and quiet. And that's the time we see resting pulse rate. Practice of yoga is a parasympathetic activation. So exercise is work out, and practice of yoga is called a work in. The moment you work in, you activate the healer within you, empowering the healer within. Finally, the moment you learn how to able to quiet down your mind through your mudras, called hand gesture, closing your eyes, because eye is a direct extension of your brain, able to control your other senses through the healing power of breath, you awaken the healer within you. So our simple practice, which you do all the time, quieting down your mind starts first with the balancing both sides of the brain. Here I am sitting down. Stillness, happiness, and an asana. I've changed my feet. Easy pose. Second, looking within yourself, no pain. There should not be any pain during your asana practice. If you have a pain, back off. Find a place where you have a little comfortable discomfort. We don't want you to be in a total comfort. Yes, you are in total comfort when you are practicing after a while, but initially we call it a comfortable discomfort. After a short time, you will see we'll do with your mudras, eyes closed, breathing, which you'll do slowly this thing will happen. How this thing will happen? You sit down with your spine straight. Touch your index finger and thumb. This is your Dhyana Mudra, Jnana Mudra. It quiets down your Pitta dosha. Pitta is the fire within you. And the moment you control Pitta and the Vata, both are controlled this together. Put it gently over your knees, close your eyes. Bring your awareness to your breath. Your breath is the complete guide for your looking inside you. Introspection. And let me tell you how it happens. When you are in a physical asana, slowly and slowly you will get into the poses. As we always said, in stages, impossible become possible. Suppose you could not touch the toe, and the day you will touch the toe, you will get a signal from within you. Hey, I could touch the toe, which I could not do it before. Let's do one thing. Let's see what is my digestion. Let me see what is my elimination. Let me see what is my sleep. That is my health. We learn from the babies. A healthy baby will eat, poop and sleep. Healthy person will have a strong digestion, easy elimination and good night's sleep. We have done this lot of program with that. I will do it again with you, not today, but we'll talk about it more and more. You activate the healer within you. Self-realization. Realization means real eyes. You develop an eyes which is turned around. Instead of looking outside, you start looking inside. Start with your breath. Breath is the connector between our body and mind. Metaphorically, if your body is like a roller, mind is like the kite, and the breath is a thread connecting the roller with the kite. When eyes are closed, spine is straight, hand is in a meditation mudra. I'm visualizing my breath. My breath is coming out first through my nostril. I'm visualizing my breath is, air is coming through my nostril with my inhalation. I'm visualizing the air is coming through my nostril. My nostril is a filter. It's filtering my outside air. My nostril is like a local air conditioner. Outside air is warm, is going to cool it down. Outside air is cool, is going to warm it up. Air is going to the side of my nostril. There is a groove which is called a turbinate. Turbinate converts the air into a vortex. This vortex is riding over the opening of the sinuses and the sinus mucosa. This vortex from the sinus mucosa releases a substance called nitric oxide. Nitric oxide is a very potent vasodilator. It opens up the blood vessels. Nitric oxide is an activator of parasympathetic tone. Other activator of parasympathetic tone, cyclic GMP, acetylcholine. Now air is coming behind my throat, in the larynx. It does not go into the pharynx. It does not go to your stomach. The whole air goes into your larynx, through your trachea, into your lung. Coming behind your throat, upper part of the lung, middle part of the lung, lower part of the lung, almost to the level of my belly button. Here the breath stops without knowingly. Cable kumbhak. Cable kumbhak. Breath holding at the level of your belly button. Visualize air is coming out from the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat. Air is coming out through your nostril. Outside the nostril, the air picks up our life force called prana. Prana is a subtle energy, non-measurable, putative, non-measurable energy which keeps us awake, alert, and alive. Breath is the carrier of prana. Prana is like an electricity, and breath is like electric cable. It's carrying the prana. In yoga practice, every organ does their own breathing. It's not only lung. The skin is breathing, the liver is breathing. The prana goes to the organ of healing. For me, I had open heart surgery 21 years back. My prana is going to my heart to cause the healing of my heart. Pranic healing. That is the healer within you. The mudras, hand gestures, is the health in my hand. Mudras are a neurophysical connector of guiding the prana to the organ of healing. That's what is empowering the healer within you. In this practice, my whole awareness is in my breath. All my senses are in control. My mind quiets down and I am awakening the healer within me, and the healer is telling me, yes, last night you had this food which was not properly digested. Improper digestion of a food causes smell in your excreta. Next day your urine will smell, your stool will smell, perspiration will smell. That means your food was not properly digested. Belch will have a smell. After proper digestion, you will have a lightness in the body and mind. Appropriate hunger and thirst. To be hungry after 4 to 6 hours of a main meal. You're not going to be hungry in between. There's a reason for why do you get a hungry in between. If your sugar level is high, the body is releasing insulin to lower the sugar, and after lowering the sugar, body has more insulin left. That insulin acts on the brain and tells the brain, hey, I need more sugar. Craving of the food comes from sudden spike of your sugar level. Eating brown rice, whole wheat bread causes slow rise and slow fall of your blood sugar. Does not create a rebound phenomena, does not make you hungry unless you have a proper digestion. Your breath, you feel clearly my number of breath is coming down. Normally we breathe 15 to 16 breaths per minute. Simply breathing out first, 2 seconds in, 1 or 2 in, 4 seconds out, 1 and 2 and a 3 and a 4. Simply inhalation 2 seconds and exhalation 4 seconds will reduce your respiratory rate to now 10 per minute. Exhalation is parasympathetic, inhalation is sympathetic. Long exhalation will quiet down your mind to tap the healer within you. Able to lower the respiratory rate, you will develop a neuroplasticity and you will be breathing like that when you are even sleeping. Your respiratory rate will be lower throughout the whole day. We have seen in the animal world, the animal who have a high respiratory rate, they live lower than the animal who has a lower respiratory rate. When the respiratory rate is low, you live longer. Simplest way to say, I have a fixed number of breaths in my life. My breathing rate becomes slower, I live longer. Breathing rate is higher, I live shorter. Extend your exhalation, extend your life, longevity. For us, we've been doing it so long, I can show it to you how easy for us to breathe out 8 seconds and breathe in 4 seconds. Even you can go about breathe out 16 seconds and breathe in 8 seconds. Breathe out even 20 seconds, breathe in 10 seconds, but totally effortlessly. Totally with a mouth full of saliva, parasympathetic activation. So let's for a demonstration, let me do it 4 seconds in and 8 seconds out. In our practice, we always breathe out first. Four seconds in and 8 seconds out. Very easy for me because I've been doing it, practicing daily, and I practice for a long, long time. 6 seconds in, 12 seconds out. Breathe out first. When you have a cough during a breathing practice, that means you are really breathing all through your larynx. Cough reflex comes from your larynx and all the air is going. It happens more often when you're doing a Ujjayi pranayama. 6 seconds in, 12 seconds out. Very easy for me, 6 seconds in, 12 seconds out. Also, when I sleep, my wife will definitely tells me that your exhalation is longer than inhalation and your respiratory rate is a lot slower when you sleep. Eight seconds in, 16 seconds out. Breathe out first. Extremely good feeling. To the feeling now that I have been awakening my healer within me, even on my this, touching the tip of my fingers. I can clearly feel the capillary pulsation. All my capillary pulsations are very palpable. My sensations are going down. I don't feel much when I'm touching in tip of my these fingers. I'm developing this introspection, looking inside myself. Slowly and slowly, I can feel whole my face. The tightness is gone. The frowning is gone. The muscles in the face gets relaxed. Progressing to the same phenomena slowly from Sukhasana to call it Siddhasana. This is your perfect pose. Take the heel to the back. Put your other foot on the top. Use your hand like called Adhi Mudra or Balo Mushti Mudra, like the fist of a baby. Thumb inside and close and put it on the top of your knees. The moment keep your spine straight, eyes closed, pay attention to your breath. You are activating the healer within you. Back to the opposite side. You take your time, you keep on practicing. As always my final statement, in stages, impossible become possible. No question about it. One side is easier than the other side. Balance and paying attention to your breath. Breath is your life. God made us from the clay or from the dust, whatever being used to create our physical body. Then put the breath on us to be alive. It's everywhere. Every tradition, every faith, breath. Genesis, I said that. Every scripture. Putting your hand in between the toes. See that? Relaxing the toes. Relaxing the hands. When you separate the toes, separate the fingers, you bring a relaxation response. Half lotus, Ardha Padmasana, Swastika Asana. You will be seeing more and more you will be able to do this relaxation response. You are entering into the sense of profound relaxation and activation of your parasympathetic tone. No pain. Effortless breathing. Effortless breathing means you are able to talk. You are able to sing. We have people with a very bad knees. Knee joint is the first joint which gets into the problem. Knee joint is a very complicated joint. All of our weight is transmitted here in our ankle joint. hips and knees are both is transmitting our body weight. But still, it's a joint of a lot of bones, a lot of ligaments, and the stress comes to this joint enough. When you have a little bit of drainage from your nostril after your morning Jalnetya Neripat, you do a little Kapalbhati Pranayama like this. Also, what we practice is that we do a Kapalbhati Pranayama closing one nostril. My right nostril is closed, I'll do the left nostril. I'll do it my right nostril. Many a time on our personal experience, what you notice that when you do your Uttanasana, like hand touching your feet, you'll see some water will drain out from your nostril after your Jalneti practice. Entirely normal. People always ask me, oh, my nose, I'm really afraid to put the water in. What kind of water? If you get a drinkable water, put it. United States is not an issue what kind of water you use. I've been to so many other countries, and every time I say, if you're comfortable, use a boiled water. If you're still not comfortable, use a sterile water. But any water, drinkable water is good enough. And for the nose is extremely resistant. Think about you go and taking a dip in a public pool. You have no idea the quality of water in the public pool. All are going inside your nostril. But you're still fine. Nothing happens. Nothing happens. Nose is your gateway to your brain. Now you put your feet up. You're in a lotus position. Padmasana. Padmasana with meditation mudra called Dhyana mudra, Jnana mudra, with your eyes closed, spine straight, paying attention to your breath is the. Remember, three Ds is the preventive medicine. This is your preventive medicine. Take the words, and you'll be able to defend yourself, because this is the posture where you are activating the healer within you. You are empowering the healer within. Padmasana, lotus pose, Jnana mudra or Dhyana mudra, meditation hand gesture, closing your eyes, quieting down your five senses, paying attention to your breath. Exhalation longer than inhalation. Nothing could be better than this to activate the healer within you. Keep practicing. Keep practicing. You will have a wonderful healing. You will maintain a disease-free life. Medication-free. At our age, average people are taking at least 10 to 15 medications a day. Pharmaceutical companies have been grabbing us. They call pharmacomafias. disease-free, medication-free, a quality life. Quality life is like your energizer buddy, energizer batteries. Wake up 5:30 in the morning, continue your daily routine, dinacharya. Go to bed by 10:30, and we have described our dinacharya. We'll do it another time and see. Yoga therapy is the preventive medicine, is the daily routine, dinacharya. So, this is your relaxation. This is our healer within you. And throughout the whole day, the practice you do, keep your body moving. Now, I hear all the time from all the yoga practitioners all over the world, okay, sitting down is bad. Get up and stretch. Okay, stand up, put your hands high up, put your both sides. Tadasana, Utthita Tadasana, upward mounting pose. Tirjak Tadasana, oblique mounting pose. Here I am. You have seen this may be my kneeling stool in front of my computer. My table in the computer now is motorized. Motorized for reason. The reason they're motorized, that you can raise it up and walk and work with your standing. But I use the motorized table to keep the table at the level where I can put my spine straight throughout the whole day. So have a kneeling stool. You will see relaxation response will set in. Spine will be straight throughout the whole day. You'll be getting rid of lifestyle related disorders. Yoga is a cure all for lifestyle related chronic diseases. Better management of the disease, better quality of life, and less pharmaceutical support. Able to sit down in a squatting pose is your daily activation of your body and mind. You can do standing, stretching, everything throughout the whole day. Whenever you get a chance, people ask me, how many times I need to do? I said, do it effortlessly. Do it without any pain. Sit down in a squatting pose as possible. Separate your fingers, it relaxes your hands. Extend your wrist, relaxes your wrist. One elbow inside, other elbow inside. Slowly bring your hand close to you. Keep your spine straight, eyes closed. Breathing out longer than breathing in. This is a posture of your preventive medicine. This is also my preventive medicine. Sitting in a lotus position, Padmasana, with a hand mudra, and paying attention to your breath was a preventive medicine. And this Malasana is my preventive medicine. Next preventive medicine and sign of health is able to get up without a support. So when I get up, as you can see, I'm here. I don't know if you can see me well. Okay, I'm here on my kneeling stool. You can see my back. In a kneeling stool, my back will be straight. And here is my computer table. Here is my computer table. and my computer table is motorized. Okay, let me show it to you a little bit. So I'll show you. Hopefully I'll be able to show it to you when I'm talking. I don't know if I can do that from this angle. So here I am. I'm sitting in my kneeling stool. And if you sit down, this is it's going high up. And it will come down. It's a motorized table. So it comes down to the level where I am in a posture, whole thing is just in front of me, my eye level. And my keyboard is at the level my spine stays straight. Daily routine, dinocharya. So, the last practice throughout the whole day, which will bring your awaken the healer within you. Able to sit down in a squatting pose, able to get up from the squatting pose, able to get into a posture where your whole body will be straight, or maybe here. Put your ankle at the level of the wall. My head is a door. Keep your hips, shoulder, head straight looking, and hands will go high up and touch. So you'll also see when you put your hands high up, or straight high up, not like this. Try it initially, it will happen, but straight high up. I'm comfortable standing like this. Bring your feet together. Stand straight, stand tall. Eyes closed. The moment you close your eyes, you start bringing the awareness within you. This is working in. Empowering the healer within you. Balancing, cross your feet. Crossing your feet, you go down. Crossing your feet, you get up. Cross your feet on the other side. Go down and get high up without the support. If you practice this, you will feel it within yourself, and you will see how effective it is for your health and healing. When I go to see the doctor will tell me, this level is little low, this level is this, you need this, you need that. I said, I know. How I know? I have the chart, my last 30 years of all my lab results and my health. It is not the present day, my hemoglobin is 12 grams. My hemoglobin is 12 grams for the last 25 years. My present doctor said, oh, your hemoglobin is a little low. I'm totally functional. This has been going on for the last 25 years. I had my colonoscopy done, I have my stool foracle, but there is no source of any bleeding. I'm not worried about it. Because I have the healer within me. My healer is telling me, Yes, this 12 gram hemoglobin is good for you. You don't need the 14 or 15 grams of hemoglobin. Yeah, it goes to 14, so it's okay. Nothing wrong in that. Yes, if it goes down to 9 grams, 8 grams, 6 grams, 5 grams, that's sign of chronic blood loss, some bleeding inside. At this age, most common bleeding is the first source of losing blood at this age is a cancer of the colon. If you see somebody comes to you at this age and says, my hemoglobin is 6 grams or my hemoglobin is 8 grams, get a stool for occult blood and get a colonoscopy done right away. Stomach irritation from all the medications we take, especially pain medication, is another source of bleeding. And that is generally called a black stool. If you are able to sit down all the way down into the ground, and from all the way down to the ground, if you try and if you can get up without the support, that's your daily practice of the awaken the healer within you. If you do balancing poses, if you put your hands together, let's see if your hands will fall down. Put your hands into the back. Prayer pose to the back. Put your hand into the back as a prayer pose. Paschim Namaskar. Do your balancing pose. Here is your triples, Brikasha. We don't practice pranayama standing up, but we practice Kapalbhati pranayama is a very relaxing response. I can do it Kapalbhati pranayama here. I'm relaxed, I'm in a balancing, both in my Brikasha tree pose and my Paschim Namaskar. Can't beat these daily practices to awaken the healer within you. Same, Paschim Namaskar, opposite side. Below your knee, above your knee. Kapalbhati pranayama. So all the practices like head below your heart, a wonderful practice. But the best meditative practice when you awaken the healer within you is your alternate nostril breathing, especially alternate nostril breathing without closing your nostril. That's your meditative practice. Let's do the alternate nostril breathing without closing your nostril and in the state of silence. We'll do a few minutes before we do our palming and cupping. You can easily, if you're practicing daily enough, I can go slowly, as I say, step by step, or also I can go into your Padmasana lotus position. Hand in the Dhyana Mudra. bring your awareness to both the nostrils. As you know, we have three bodies: gross body, sthula sharir, subtle body, sukshma sharir, causal body, karana sharir, connecting to your body, mind and spirit. When your awareness is within you, when you have a self-realization, they realize, when the eyes turn inwards, not outwards, you access your subtle body. Subtle body is the body of your mind. You've been looking at this body for years and years and years. Your brain has a total imprint of this body. Touch the top of your head, closing your eyes. Touch the left shoulder. Touch the right great toe. Left hand, I'm touching my right knee. So that is the way I can access my both the nostril without closing the nostril. Breathe out first through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly see I'm breathing through one nostril, breathing out through the other nostril. Your eyes are closed, you are in a state of silence, and in silence practice alternate nostril breathing without closing your nostril and keeping your spine straight. You slowly enter into a state of meditation. Meditation is the medication. Prepare your physical body in sthiram sukham asana, stillness, happiness asana pose. Prepare your breath with a complete effortless breathing. Exhalation longer than inhalation. You'll be entering into a state of meditation. Meditation is medication. Difference between meditation and medication is one T and one C. Meditation has a T which is called transformation. Transformation from rogi, disease, to nirogi, no disease, to yogi, a wellness. And in medication, C is the choice. Your choice of taking the pills or choice of activating a parasympathetic response, relaxation response, and activating the healer within you, empowering the healer within. Take both the hands, keep rubbing your hands. When you feel the warmth in both the hands, if you're wearing glasses, remove your glasses. Take the hands like a cup. Put it both over your eyes. Let the eyes take all the heat from your hands. It relaxes the ciliary muscles. Relaxes the whole eye. The convexity of the lens gets bigger. And your eyes are relaxed, your mind is relaxed. Massage all the forehead, face, eyes, face. All the muscles in the face are attached to the skin. When the muscles are relaxed, the lines goes away, all the frowning goes away, all the lines in your face goes away. Take your hand, massage in your earlobe, back of your ear, in front of your ear, inside the external auditory canal. There's a branch called auricular branch of vagus nerve. Activates the vagus nerve, which is the parasympathetic response. Take the hands, massage the both sides of your carotid sinuses. Carotid sinus massage is used for our supraventricular tachycardia. It quiets down your cardiovascular system and nervous system. Take the hand behind, massage at the tubercle. Here is insertion of the trapezius muscle and sternomastoid muscle. Two muscles supplied by the cranial nerves. Your cranial nerves quiets down, quieting your mind. Bring the hand in front of your heart chakra. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. Padma Mudra. Lotus Mudra, it connects your body, mind and spirit. Slowly bring the Lotus Mudra close to your heart. Heart is the site of your soul. In yoga, all the hand gestures, mudras. Whatever hand gesture you do, you see that through your eyes. Once you see this through your eyes, that becomes your mind. Mind is connected through your soul. The soul is at the level of your heart. Heart is also side of your all the emotions. Remember, any emotion will have a physiological response in the heart. If you have a sudden fear, heart rate goes higher. Breath and heart are together in the same organ. In yoga, lung and heart is the same organ. If you see something beautiful, it's a breathtaking. The moment you empower and activate the healer within you, you are in a state of preventive medicine, Shastra Rukha, Bring the hand in front of you at the level of your heart chakra. Bow your head down. Say Namaste. I honor the divinity within you. You are divine, going to be healed, and I'm here with a mouth full of saliva, showing I'm in a profound parasympathetic activation. I'm relaxed. I'm very much with your mind. Lotus pose, and we'll be back next Saturday again with another topic on yoga therapy based on our profound experience. Okay, see you next Saturday. Bye-bye.